All right, we're gonna do an NG tube and an OG tube, and we're gonna secure it too. So first thing that we're gonna do is we got our lube right here. We need to lube this. Okay, we get some lube on the distal tip of this OG tube. Then what I like to do is if you come down here to the mouth, I like to grab the lower jaw, okay, and just go ahead and lift that face off the table. Really get that tongue off the posterior pharynx. And then this should slide in, okay? Try to insert it with the curve of the tube following down to the esophagus, not following back up into the head, okay? So we insert it like so. And then if you are lifting the head up appropriately and it goes right down the middle, that should just continue to go in, okay? Sometimes it doesn't go in because it's hitting the right or the left side of the pharynx. And so sometimes when that's happening, you really just have to put your finger down in the mouth, and when you advance, try to figure out where that's hitting and try to redirect it with your finger and push it down with your finger. Okay, so that's an OG tube. An NG tube is the same, except we go through the nose. So let's just say this is lubed. Okay, just be careful that you are inserting it so that the curve of this tube is going in that direction, not that direction. Also make sure that when you put this initially in the nare, that you don't push it back and advance it towards the head, okay? You want to try to make it perpendicular, as perpendicular as possible. Okay, so we get that initial insertion, and then we just insert it the exact same way, okay? We just lift the face off the table here, and we just go until we meet some slight resistance, okay?
Alright, all we're going to do is just get a piece of tape about 4 inches or so, tear it down the middle, about 3/4 of the way, and then we'll just place the untore piece on the nose, and then we just wrap one of the edges around the tube, and then we take the other piece and wrap around the tube and go down the nose.
Okay, now one more thing that we're going to share is how to take one of these out. Well, first of all, this is where NG tube is worthless without this piece, so don't lose it, okay? Because that's where our suction is going to connect. Okay, so once we're done with the operation, it's time to transport the patient. We can go ahead and take this section out and just occlude it right there, okay? Because wherever they get to the PACU or to the floor, they're going to have another one of these adapters that they can hook it up to suction with. Anyways, when it's time to take one of these things out, I see students do it the wrong way. We hook up here, and then they take it out with 2 fingers like that, and they contaminate both of their hands, okay? You don't want to do that. You want to just, with your right hand, hold the proximal tip of it, and then with the left hand, pull it all out with just one hand, so that when you're done and it's time to discard, your right hand is still clean.